Hello, cherished viewers. I'm super excited to bring you yet another explosive edition of Kids Corner. It's going to be interesting today. My name is Dr. Z, and I have with me a very important guest. Before I introduce her, I'd want you to share the post, leave a comment, so that others may benefit from the insightful discussions we'll be having here. Today we'll be discussing what every expectant mom should know. And I have with me a pediatrician specialist. She's a wife, a mother of so many kids. Someone I personally admire and respect a lot. She's my boss. She is in the person of Dr. Rita Fusi. Well, Doc, you're welcome.
Thank you very much for having me.
Doc, what will you say is the general expectation of the society when it comes to pregnancy and childbirth? I know that by and large this is influenced by the geographical location, by some socio-cultural factors. But narrowing down on our society, what would you say is the general expectation?
I think generally people would expect that when they get pregnant, they will carry it to term, what most of us would term as 9 months, and deliver vaginally. The normal delivery that we know of. So generally, when people are in their early parts of their pregnancy, that's what they expect. But usually, it's not always the case. What we generally know is that 1 out of 10 pregnancies would end up with a preterm delivery. They don't end up going to term. And some babies are also born not healthy, because people would generally expect once I'm pregnant, I give birth to a bouncy baby boy, bouncy baby girl. But sometimes children are born sick. And also throughout pregnancy, women would expect that they are well. I mean, even if they have early morning sickness, they expect that after the first trimester, they're able to overcome it. But there are a lot more complications that women can be sick, develop hypertension in pregnancy, have diabetes in pregnancy. Children are born really before their time. And sometimes they are born that early that they would not even survive. Or other times, they don't even make it alive.
Oh.
Yeah, so that is it. Everybody expects a good outcome, but it is not always the case. And I think that it's important that pregnant women or the society would really understand this concept, because sometimes they see someone pregnant for a while and maybe the person loses the pregnancy or the person delivers and doesn't have the pregnancy. Say, hey, Obanewe,
I know that.
And it's such a sad feeling for these mothers. So I think that maybe it's about time we change our perception about what to expect.
That means that there may be a difference between what is expected and then the reality we face during pregnancy. You made mention of the fact that you may have kids falling sick, the pregnant woman falling sick, and something can happen to the child in utero. As a pediatrician, what common health issues can occur to a child during pregnancy or after childbirth that mothers would have to be mindful about?
Especially during the pregnancy period. One of the things that mothers would have to be mindful of, one, is what we eat. A good nutrition affects the ultimate outcome of the baby. Sometimes people are sick, they don't eat well, others overeat because they say, oh, I'm eating for 2. And then they can eat everything in this world because they are pregnant. The other thing is health conditions. Some people already have what we call underlying health conditions. The person might be a diabetic or might even have pregnancy before childbirth. But one of the things we need to note is that pregnancy in itself can also make some mothers prone to having pregnancy in hypertension and diabetes in hypertension. Others also partly because of what they eat or maybe because of underlying conditions like sickle cell anemia will tend to be anemic during birth. So these things would negatively affect the outcomes of the baby, because generally we know that mothers who have pregnancy and hypertension will tend to give birth to smaller children, or mothers who have some form of chronic condition would also tend to give birth to smaller babies. If you have a mother who is diabetic, then she would give birth to a large baby. And not all large babies are healthy. They come with their own, what we call it, problems, health issues, just because they are born large and all that. After even the baby has been given birth to, things like when we decide to breastfeed that baby would also make the baby prone to falling sick. And some of the things we give to them, I have seen mothers give coconut water to babies. I have seen mothers soak bread in water and it becomes whitish and they give to babies as their first meal. All these things will make the baby sick. Two, some of the cultural practices we have as a country, that if I give birth and I go out within the first week, evil eyes, anybody will see and give the child a SRAM.
Yeah.
So the child's color will change, become jaundiced. But because we are in a dark room, also his eyes or her eyes cannot adjust to light. So and all that. These things would make us recognize jaundice in the newborn very late. And it sometimes would lead to very bad outcomes. I remember meeting a couple and their child, and I had seen some years back severe case of neonatal jaundice. The child was already 3 years, could not sit, could not walk or anything. So sometimes even the illness is not during the immediate newborn period. It has repercussions as the children grow. And things like fever. People think that fever in children are normal, or maybe when they have a fever it's because they've cried too much, so they don't seek medical attention. All these things would make children sick during the newborn period. So I think these are things that we should look at critically and address them. Yeah.
That means that if a mother, say, has a comorbid condition, hypertension, that can affect the child during pregnancy. It's also possible the mother can develop hypertension during pregnancy. And all these comorbid conditions, diabetes, hypertension, sickle cell disease, asthma, can have adverse effects on the fetus. You can have, Doc is also saying, you can have a normal mother who may also have a child who is growth restricted. Your child may also have some malformations. And so all these things are things that may occur during pregnancy or after childbirth. She also made mention of jaundice. I personally believe in proactivity. So how do we as mothers, I know there are a lot of ladies watching me, how do we as mothers prepare and position ourselves for some of these unexpected things? Because I personally, or I would say, I wouldn't expect that I would be pregnant and this or that would happen to my child. How do I prepare or position myself for something like this?
One of the things I think we should do as women is to be ready for the pregnancy. Sometimes we are not ready. Both physically and psychologically. Me, I like sharing stories, so I'll share another story. If someone delivers in my facility, anyway, she was also a teenager. And then she comes in because mother thinks it's usual abdominal pain. And then he comes to deliver a 900-gram baby. So she had never attended antenatal clinic. And it doesn't just happen to teenagers. You have mothers married women who would say, oh, my child is like 3 months, I'm pregnant again. So you are really not ready, prepared for it, both physically, because you are nursing one baby, just came out of being pregnant, And maybe psychologically, because I've seen married women saying, "Oh, I would really want to abort this pregnancy because really I'm not ready." The first thing is you must be ready, physically, psychologically. Two, we must educate ourselves like we are doing, because if you have no idea that sometimes pregnancy can predispose you to having something like diabetes in pregnancy or hypertension in pregnancy, then you will not take your antenatal clinic serious. I mean, especially for what we call the gram motives, people who have delivered, they said, "Oh, my water," so they would not attend antenatal clinic. It is important that we attend our antenatal clinic, because that is when some of these emergencies can be picked, even through the scans that are taken. If your child has a major, what we call a major malformation, it can be picked there, and then it gives you the ability to decide, of course, with your doctor's advice, whether you want to carry this pregnancy all the way or whether you would not want to carry it to term. The other thing is nutrition. I mean, these are things that we all know, that in pregnancy we should eat well. Eating well doesn't mean eat everything, because, I mean, people especially people who are healthy in pregnancy and they really have a good appetite, will tend to eat everything they want because they don't feel sick. And usually it comes with these attendant problems. You gain too much weight than you're supposed to gain. And two, it affects the birth weight of the child. Remember that if you have a child who is too big, then they will come out with complications. That is when they have birth injuries, issues, and all that. And don't eat too little. People also tend not to eat well because they just don't feel like eating. You must realize that you are, I don't want to use the term eating for two, but there's another body, there's another human being inside of you, and you need to take care of them. Exercising looks like it's alien to our culture. Especially when women are pregnant, but it's important. Sometimes women would think that once I'm pregnant, I don't do anything. Everything the husband has to do for her. Pregnancy is not a disease. I mean, it's a stage of life, and I tell people it's something you must enjoy. So you must make a conscious effort. Take a little bit of walk when you're pregnant. I mean, brisk walking, not the one that everybody sees you're pregnant, so you're just dragging your feet and all that. So exercise is important for the ultimate outcome of babies. Of course, especially when you go to your antenatal clinic, you have to take your multivit, you have to take your folic acid. In fact, when I talked about the being ready, one of the things that women in reproductive age, if you know you are ready for a baby, you even have to start taking your folic acid before you conceive. So these things, and apart from having your exercises and eating well, you should take good care of yourself. Sometimes, I mean, we are pregnant, so we can't no longer visit the salon. We don't want to look good, especially people feel if you are pregnant and you look good, evil eyes will see the baby. One other good thing is that, especially when you're getting to the end of pregnancy, is because of the baby bump and everything, sleeping becomes a bit of a problem. You must make conscious effort to sleep and to have enough rest. Drink lots of water. These things will help in our outcomes ultimately.
So let me reiterate what Doc said. Get ready for the pregnancy. Okay. Get educated. Okay. Eat well. Sleep well. Exercise. Take all your routine medications given during at the ANT clinic, and adhere to everything your doctor asks you to do. Doc, many women fuss about mode of delivery. I've actually had a friend say that for her, she would never go for natural delivery, spontaneous vaginal delivery. For her, it's surgical delivery all the way. Would you say one option is better than the other? And how should women or mothers approach the choice of mode of delivery?
I would say that no choice. One choice is not better than the other. I'm even surprised at this this story you're sharing with us, because usually in our typical society, women think that when they go through vaginal delivery, then they are more women, more of a woman than the other. As someone shared a story with me when apparently two ladies that lived in like a compound house had a fight. One had cesarean section, one normal delivery. And the one who had normal delivery said, I mean, literally questioned the femininity of the other woman because he did not deliver vaginally. And what is the trend now, especially with women in middle class, is I'm going to do vaginal delivery. And now people have the option to say that. So I would say that one option is not better than the other. What is generally known, that vaginal delivery is the most common and is the safest. But of course, there are indications for cesarean section. I mean, these decisions are not to be taken lightly. You have to discuss with the doctor that is seeing you. Sometimes there are medical emergencies, eclampsia, preeclampsia, that would necessitate that a woman who maybe even wants to opt for vaginal delivery has to go through cesarean section. But by and large, I think it's the same thing. The most important thing is that the baby is out.
Yeah.
It doesn't make you more super woman to deliver vaginally, or it doesn't make you whatever to also deliver by cesarean section. But I would generally think that if you have the means, it's better to go by the safest route, which is vaginal delivery.
One other thing lots of women are concerned about is the change in body shape. Some have fears of losing their waistline or probably maintaining their pre-pregnancy tummies. Is it possible to maintain your body shape after pregnancy? How early can you start using the gym? And will you say the use of corsets is helpful? Does it have any disadvantage, or can it cause harm to the mother in any way?
Getting back into shape, it's really possible. It doesn't matter the number of children or babies you would have. But I must say that all these things would begin with prevention. You know, sometimes when women get pregnant, like I said, there's excessive eating. So by the time they deliver, then you have excessive fat around the waistline. So it begins with prevention. The best thing to do is to eat well during pregnancy and to make sure that the weight we gain during that period is not, overboard. The other thing is exercising. Exercising right after pregnancy would also help you get back into shape. Good nutrition, because now people say, oh, I'm breastfeeding, and they eat everything in the world, I'm planning to accommodate me, and all that, and not do a lot of exercise and all that. So I think that the best thing to do is to try to prevent excessive weight gain around the tummy during the pregnancy period, but still have maintain a good diet. In gymming, if you do vaginal delivery, it's well known that you can go to the gym a few days after delivery. Once it's vaginal delivery, you do not have any, contraindications. in going back to the gym. In fact, it's actually said that for women who are very active and were already going to the gym even whilst they were pregnant, they could start as soon as is possible. Otherwise, what is generally advised is that during the first few weeks after birth, at least you have like 10 hours per week.
Oh, okay.
So of some form of brisk exercising if you want to be motivated, because I mean having a child and going back to the gym is not something that is easy to do. You may want to have form a group with mothers. I mean, you meet mothers who you bond with during the antenatal clinic, so you could have a group like that, or simply use some of these exercise videos for postpartum mothers, and you are good to go. If you had cesarean section, generally people would want you to wait a little longer compared to women who have gone through vaginal delivery. Really, there are no straight timelines as to when to go back, even for women who have gone through cesarean section. Others would generally advise after 2 weeks you are good to go. Others would put it like 6 weeks. Yeah. And the use of corsets. Yes, corsets are recommended even by some obstetricians, especially for vaginal delivery. They recommend that a few days after delivering you can put on a corset. But you know our place, people will go and buy any corset without taking their size and shape, everything. You know, people have measurements of what you can wear, so it should be something which is appropriate for you. And the ideal thing is that you start a few days after birth, and for you to see results you should put it on for about 8 weeks, 6 to 8 weeks, also about 10 to 12 hours in a day.
Oh
yes. So if you are not disciplined, it's difficult to do. And generally for women who have gone through cesarean section, then their general advice is to wait till at least your C-section wound heals. But you would, and of course you have to discuss with your doctor. Some women actually claim that even when they are sore, they use the belly band, which is not like the corset with all those small clips and all that. A belly wrap or band, which is smooth. It's okay. It's okay. So using a corset is allowed. It helps you get back into shape.
All right.
Maybe on time, but you have to be consistent with its use.
All right. Lots and lots of interesting discussion going on here, but let's take a break. Okay, we'll be right back. Doc, let's zoom in on breastfeeding. What are some of the common issues that you are faced with at the child welfare clinic with regards to breastfeeding?
One of the commonest things that we are saddled with day in and day out is that my baby is not getting enough. So I want to give breast milk substitute. I want to give a formula feed. The other thing we have with our mothers is my nipple is sore, and because of that when the baby feeds it's painful, so I'm not going to give the breast milk to the baby, or my breast is engorged and I can't do much about it. I mean, it's usually our mothers at home and our grandmothers who would say, oh, give the child water. Have you seen a baby? When you eat yourself, don't you drink water? So you have babies who've come to the hospital with infections because they've been given other things other than water, or you are saddled with a baby who is sick because mother felt that baby was not getting enough, and in trying to give a formula feed because she did not know exactly how it is prepared well, the baby tends to be sick, and then the baby is brought to the hospital. So generally, these are the things that we see. But one of the things about breastfeeding is that if you want to successfully breastfeed, you must let that baby latch onto the breast within like 30 minutes after birth. Okay? Especially for our CS mothers. They are the ones that are likely to say, oh, my breast, and I don't want to breastfeed and all that. So, I mean, some of these things should begin at antenatal clinic. That we teach our mothers about the importance of breastfeeding, how to position the child. Because if you don't position the child well, mothers would breastfeed and they would bend over the babies. Then they would have backache and they don't want to breastfeed again. Or the way she's positioned the child, especially for our new mothers, is so awkward that the baby doesn't also latch onto the breast well and feed well. And sometimes it is just because we don't know what to do. Mothers will come to us and say, look, my baby is not having enough. He's crying and crying and crying. So I think he's not having enough. And I keep telling people that crying is not equal to I am not full. Crying is not equal to I'm hungry. So one of the things we teach our mothers at antenatal clinic is the signs to pick up to know that my baby is crying. Maybe he's crying for another reason. Or my baby is crying not because he has not had enough. So generally we would say that babies who are breastfed should feed like every 2 hours.
Okay.
In the initial stages, so they feed like 8 to 12 times per day.
Wow.
Okay? And they should stay on the breast long enough till the breast is empty. Because traditionally women have been told that one of your breasts is food, the other one is water. So he puts the baby on the water one and says, hey, come to the food one. When the baby has not really emptied the breast, And it's when the baby empties the breast that they get what we call the hind milk.
Yeah.
And that is what is nutrient dense. And that is what makes babies grow.
Yeah.
So please, we would really want to let our audience know that they need to have time for the babies to feed well and to make sure that the breast is empty. When the baby feeds well, what we say is that they settle in between feeds. So in between the feed he's had currently and the next feed, they are going to sleep. They are not going to be fuzzy or anything. And then 2, one of the things you can use to check whether my baby is getting enough or not is the number of times you change the diapers. Usually by day 1, day 2, you wouldn't be lactating so much, but you have your colostrum, which is nutrient dense, which is good. Some people would want to see colostrum dropping like breast milk. No, the little amount they have is enough. So usually by day 1, day 2, you may change just maybe 2 diapers. It's okay. But by day 3, 4, 5, lactation would have been established, and we expect you to change like 5 to 6 diapers per day. Okay, so it's one of the things to look out for. The change in the color of the stool that the baby passes changes from the black one. We all know that babies start to become yellowish. All these things are telltale signs that tells you the baby is having enough, and the fact that they gain weight. So on the average, we expect that at least maybe 150 grams per week the baby would gain. So if your baby is really not gaining weight, then we know that probably there's a problem with the breastfeeding. So those are some of the things to watch out for, and to know that crying is not equal to I'm hungry, and also babies cry for other reasons. But the best thing is to make sure that you initiate breastfeeding within the first 30 minutes.
Lots and lots of interesting stuff here. So listen, hunger is not equal to your baby crying, okay? The fact that your baby is crying doesn't mean your baby is hungry. Doc, I want us to zoom into mental health. I know that pregnancy comes from experience. I know that pregnancy comes with a lot of strain, physical strain, and then mental stress on your mental health. What's the worst that can occur with regards to your mental health? And how can one distinguish between normal stress, postpartum depression, and then postpartum blues?
Okay, so like you rightly said, pregnancy would come along with some level of strain and stress, which we all know is, would I say, normal. But if we are not able to handle it well, then it spills over, and then we begin to see things that we are not happy with. I mean, it starts with the same preparation that I talked about. That you must, one, be ready for the pregnancy and what it comes along with. Be ready for the baby. I mean, can you imagine approaching your delivery date and your things are not packed? You don't have the money to buy the things, you don't have your spousal support and all that, and you know that when I get into labor, I go there alone. Okay, all these things are things that can stress women. And I also talk about women empowerment. When women do not work or have any source of income, I mean, when you would go through this kind of stress, because the question is, how am I even going to feed myself when the baby is in? How am I going to support this baby? So it comes along with a lot of preparation and getting adequate sleep. One of the things we know to be the triggers of stress is when people don't sleep well. And pregnancy itself comes along with it. So you must make time to sleep, you must make time to eat well. So usually when people deliver immediately, they have what we call the postpartum blues. It's this feeling of sadness after childbirth. Usually a few days after childbirth. It would last up to about 2 weeks, and it goes away on its own. You don't need any medical intervention. It's just because women who have given birth are not getting enough sleep, and then we say there are the levels of hormones, estrogen, progesterone, suddenly drops after pregnancy. So that's postpartum blues. I mean, you just feel sad, but you're okay because you quickly bounce back and you adjust. But when people are not able to adjust, then they tip into what we call postpartum depression. Okay, so that intense feeling of sadness. And the thing about postpartum depression is that it has a history of recurrence. I had a mother who had delivered a set of twins. So she refused to breastfeed for about 2 days. So when I spoke to her, then she was like, I don't like them. I'm a dark woman. How can I give birth to fair babies? They are not mine. So I'm not going to breastfeed. So when her husband came in and then we were discussing the feeding options, and then I found out, it happened with her first child. She didn't want the baby and all that. So postpartum depression is something more severe. That one would not last for a brief period. Sometimes it goes on as far as a year. And it is said that it's a major risk factor for you getting a major episode of depression later on in life. So these women are really sad. I mean, it's a spectrum like we have with other mental issues, from mild to severe. Sometimes they are so depressed they can't get out of bed, they don't want to eat, or they overeat, they feel really like harming the baby, or sometimes they feel the babies are not good enough. Like this one, at a point in time, I was doing the reviews and it was like, so I stiff, so I Barry. So they have these ideas about the babies, that the babies are not, for lack of a better word, nice babies. They don't want to accept them. And apart from not wanting to accept them, sometimes there's a little bit of self-harm. And they feel that, well, I can't be a good mother anyway, or I'm worthless, I don't deserve these babies, and all that. When you go to the extreme end, it's postpartum psychosis, frank psychosis, being in Tumeguho and all that. So I also experienced a woman like that on my unit. And then one of our nurses noticed initially. So one day one said, oh, every dress was out, everything. So and they usually would have also issues with self-harm, and for them, sometimes if you don't take the babies away from them, they will end up harming the babies as well. So it's a spectrum. And I think that families must notice and be supportive of their relatives who go through, because for some women, especially for postpartum depression, it's going to happen after every childbirth. And we must know how to support them. If women already have issues with depression, especially those on medication, when we talked about getting ready for pregnancy and all that, people feel that, oh, when I'm pregnant, I don't have to take some medication. So she's on antidepressants, and then when he gets pregnant, and then he just comes out of it without discussing with the doctor or anything. It is a major thing that might tip you into postpartum depression, or even what we call antepartum anxiety and depression and all that. So people who already have mental challenges should be on their medication and discuss. That's the part about preparing for pregnancy. Discuss which medications you can be on if you want to be pregnant, which medications you can stay on whilst you are pregnant, so that you don't relapse when you go off your medications.
Very insightful. Please don't be the sole beneficiary of this insightful discussion going on here. Share it and let others also benefit from what we are talking about. Let's talk about resumption of sexual intercourse after childbirth. What time is right? I know most of our ladies want to hear this. What time is right?
So maybe it's not just ladies, it's really gentlemen, men who want to know when they'll be giving the green light. Generally, it is accepted 4 weeks to 6 weeks is fine. A lot of people put it at 40 days, what we traditionally call 40 days, because usually then the uterus would have been restored back to its pre-pregnancy position. But usually around 4 to 6 weeks is fine.
Oh, okay.
It's fine. And if you have it too early, sometimes the woman would risk getting some uterine infections and all that. So it's not just ladies who are happy. Maybe this should go for the men. They should wait a little. Wait a little. It's important.
All right. So men, please wait a little, okay? For our ladies, after childbirth, at least 4 to 6 weeks is fine. Okay. I remember a friend's mom advised her not to eat some kinds of foods, like plantain, like eggs, because it could result in what they call asram, and affect the child badly. What's your take on this?
I just think that there are lots of cultural practices that really prevent us from getting very good outcomes. If you look at plantain, we all know that it's a storehouse of iron, and women need iron in pregnancy. So women can eat everything. Every healthy food women can eat whilst they are pregnant. There are no exceptions. Egg will give you a source of protein. Okay, so women can eat everything. Sometimes it's not just even pregnant women. I know some people who say, oh, when children are small, don't give them meat, they will tend to be thieves and all that and all that. Please, balanced diet. That is baseline. That is what we need to have a good diet. So pregnant women can have their plantain if they so wish. They can eat their eggs and all that. I know people who really chew on carrots because they want their babies to turn out to be fair. I mean, these are genetic conditions. Eating whatever would not change the skin color of your baby from being black to white or whatever. So I think women should generally eat healthy around this period.
So my last question, there's a perception that with the new arrival, there's a shift of attention more towards the child. My question is, how can mothers and partners still maintain a healthy relationship? How can we still get our love lives sparkled up or rekindled after childbirth?
Like you rightly said, sometimes when we have a new arrival in the family, instead of actually uniting us, the sparkle leaves. And sometimes rightly so. Because this new arrival comes with an extra amount of work. And so women would tend to be more likely to be stressed out. And you know, when in taking care of this baby, because they feel they are mothers and they want to be super mothers. So sometimes there's reduced sleep, a lot of work to be done, taking care of these babies, and they become very stressed. When people are stressed, what they tend to do is that they get angry over the least thing. So it's one of the things to watch. Maybe it's not something which is very common in our culture, but it's something that we see a lot of young men now trying to do, is try to have time for the family. And it begins with planning. I've talked about planning. I mean, if your partner or your wife gives birth, you should plan to have a few days maybe off to support in the early days, okay? And sometimes too, women would feel very superior that they can do everything. I remember telling a friend, look, you can't do everything. You can't do everything, from picking cakes to cooking to everything, so that everybody will know that you're a super mom, you are the best of the best and all that. So one of the practical things I think that people should do is to try maybe assign roles, okay, so that everybody feels a part. Because sometimes for husbands, if you don't want him to do, fair enough, he's even happy not doing anything. So try and assign some roles to our male colleagues to also take part in the care of the baby. The other thing that we have already talked about is to try to make sure that there's resumption of sex. A lot of women will now say, oh, I'm tired. Of course you would be. But if you want to get back on track, you just have to ensure that you resume your sexual activities early enough. And take time off to rest. Because traditionally, sometimes people are so afraid that, oh, when I have a new baby, I don't want anybody in the house. I say, well, it depends on what you do. Because you cannot have 3 babies and say, I don't want anybody in this house. You certainly would need extra help from our mothers, from our mother-in-laws, from helps that would have to come into our homes. So sometimes you really would need to take a nap in between. So when baby sleeps, then the mother would also find a little bit of time to sleep and to relax. It distresses you so that you don't get angry over the last thing, and try to do things together. Like I said earlier on, if your husband is trying to help and every little thing you complain, oh yeah, he will not do it again. It's as simple as that. And then you get saddled with doing everything, which you can't. If you feel the way he's doing it, I mean, it is not catastrophic, it's not going to kill your baby, but your eyes do not want to behold it, probably you stay and do something else in another section of the house whilst he takes care of the baby. So I think we must learn to relax in between, learn to resume our sexual connectivity, and I guess we'll be fine.
It's been a very insightful discussion as promised, and I have personally learned a lot. I'm pretty sure you have too. Let's apply these nuggets of knowledge and share with others. And I believe that this would go a long way to improving fetal outcomes and then our health states as mothers when we find ourselves in this position. All too soon, we have to draw the curtains down on the show. A big thank you to my guests, Dr. Rita Fosuyo-Boa, for honoring our invitation to the show, to David, to my crew, Emmanuel and Co. God richly bless you. And to you for sticking and staying with us through till the end. God bless you. Stay blessed. Bye-bye.